Organ transplantation is one of the great advances in modern medicine, providing a second chance at life for people of all ages. As scientists and surgeons embrace new techniques and technologies to recover, preserve, and rehabilitate donor organs, more people are receiving transplantation surgery and with greater success. In 2024, a record-setting 48,149 transplants were performed in the United States. Outcomes after transplantation also continue to improve. While this progress is very encouraging, there's still a critical shortage of available organs for transplant. At any given time, more than 100,000 people are awaiting a transplant in the United States. Many people may experience a long wait to receive a new organ and are at risk of death while they wait. Understanding the need to improve organ availability, transplant specialists are making greater efforts on several fronts to increase organ donation, including encouraging more people to consider becoming living organ donors. The most common organ transplants are the kidney, heart, lungs, pancreas, and liver. However, surgeons are transplanting other organs with increasing frequency, including the small intestine, hand, face, larynx, and trachea. Organ transplantation is a complex procedure. It requires a precise diagnosis and a team of experts from a variety of specialties who understand not just the surgery, but the underlying health issues making the surgery necessary. And it requires dedicated healthcare staff to ensure a full recovery. Mayo Clinic is the largest integrated transplant provider in the nation. Every year, more than 150 surgeons and physicians and hundreds of trained staff perform more than 2,000 solid organ transplants at Mayo Clinic's campuses in Arizona, Florida, and Minnesota. Mayo Clinic produces some of the best outcomes in the country, including speed to transplant, organ acceptance, and patient survival. With this experience and knowledge, we want to share what we've learned about organ transplantation, before, during, and after surgery, to help those who may be on the transplant journey. We wrote this book with these goals in mind: to help individuals who may be candidates for transplant surgery understand the organ donation and transplanting process, to ensure that people waiting for donor organs are taking steps to keep as healthy as possible and be ready when that important phone call comes, to prepare transplant recipients and those caring for them for the recovery process and life after a transplant, to offer helpful tips to caregivers who play a vital role in all steps of organ transplantation, to encourage organ donation. Most important, to let transplant recipients know that they can live long and meaningful lives after transplant surgery.